Hello, it's Dr. April Kosinski, and today I just wanted to talk to everybody today about health. And everybody has their own definition of health. Sometimes people say looking good, feeling good, and anything in between. Webster's dictionary actually defines health as the optimal state of physical, mental, and social well-being, and not merely the lack of disease or infirmary. So, what exactly does that mean? Basically, it means just because you feel good doesn't mean that you're healthy. Okay, because it's talking about physical, mental, and social well being and not merely the lack of disease or infirmary, meaning that lack of disease or lack of like pain. A good example of this is like I have patients who come in all the time and they're in pain, but they still think that they're healthy. But yet when we go through their history, they have high blood pressure, they have high cholesterol, they've got diabetes, they have maybe even a history of cancer, things like that. So let me ask you this. I'm sure, do you know someone who has high blood pressure? Okay. Do you know someone who maybe has had cancer or currently has cancer? Do you know someone who has maybe had a stroke, right? Do you think any of those things are healthy? You wouldn't say any of those things are healthy, right? Unfortunately, they're very common, but just because they're common doesn't make them normal. So a lot of times what's happened now is because we get used to this idea of high blood pressure or diabetes or cancer and different heart disease, things like that. Because it's so common, we make it part of our norm, and that's not how it should be, because none of those processes are normal processes. They're not healthy at all. So I really want to challenge you on how you think about health and making sure that it's not just about looking good and feeling good. You want to make sure your entire body, all the systems, there's actually 11 systems in the body, all the systems are working properly. So some of the examples of those are, of course, your nerve system. We look at that because I'm a chiropractor and we want to make sure that your brain is talking to your body correctly, which actually is the foundation for all your other systems in your body because it all starts from up here. So your cardiovascular system, making sure that your heart is working correctly. Those signals have to come from the brain first. Your digestive system, your respiratory system, breathing, your brain has to tell your body to breathe. You're not telling your body to breathe all the time, but even your muscular system, most people think of their muscles, your immune system, lymphatic. There's like I said, there's 11 systems in the body. You want to make sure that all of them are functioning properly and at 100% and at the most optimum that they can be. So yes, chiropractic does actually tie into that, because when we work with the nerve system with clearing any interference between the brain and the spinal cord, it not only works on the muscular system, which is what most people think of with pain, but also works on the other systems as well. So it does help improve digestion, and it can help improve sleep and energy and things like that. So I highly recommend that you do see a chiropractor, get checked out, even if you don't have any pain, because overall we want to improve your health and get you to the optimum and close to that 100% as possible. Hopefully that challenged you for today and made you think a little bit differently, and I hope that you're moving towards health and not away from health. All right? Go get checked out. Have a fantastic day.